Good evening, everyone. Happy Sunday and happy World Health Day 2024. For those of you who are new on our platform, let me introduce this association. First of all, my name is Dr. Nwugo-Achapokri, National Coordinator for the Association Against Child Sexual and Gender-Based Violence. So who are we? We are a non-profit organization dedicated to combating sexual gender-based violence and promoting social justice and gender equality in Nigeria. Our services include prevention, survivor support, advocacy, and capacity development. We have reached thousands of individuals and children, provided aid to survivors, engaged with states and local government areas, advocated for initiatives, and empowered individuals through capacity development. Our target beneficiaries include vulnerable women, children, the LGBT individuals, and those living with disability or terminal illnesses. The organization has a structured governance system and holds mandatory meetings and publishes periodic publications in the Peace Places magazine, for example. Welcome again to this platform. I bring you greetings from the Board of Trustees, the Governing Council of this great association, and the National Executive Officers to this virtual symposium for the World Health Day 2024, themed My Health, My Right. As a national coordinator and moderator, with my co-moderator, Princess Favor Ajagbe, one of our directors for our Training and Education Committee, will be anchoring this program. And I am delighted to host this event where we advocate for equitable healthcare across and address systemic challenges. We are honored to have 5 distinguished speakers joining us to share their expertise on health rights. Together, we aim to empower individuals to assert their right to health and well-being, especially considering the impact of factors like gender, poverty, weak economic capacity, and violence. Let's engage in meaningful dialogue and explore strategies to advance health equity. Thank you for being part of this important conversation. So before we start, let us open this event with our second stanza, which will stand for our prayer of our national anthem. IT, please, our second stanza of our national anthem should be taken now. Thank you very much. Let's go. Amen. God bless Nigeria. So without much further ado, may we have a roll call of organizations. Those who are present, please kindly introduce yourself quickly. Yes, Mrs. Elizabeth, you have the floor, ma.
Hello, good evening, everybody.
Good evening, ma.
Happy International Health Day. My name is Elizabeth Acha, I'm chairperson, Nigeria Association of Women Journalists in Benue State.
Yes, thank you very much, ma'am. You're welcome. So I'm Princess Ighorodje. I'm co-hosting this session, and I'm also the founder of the Women Inspire Network. So I want to welcome you all to today's event, and I look forward to the immense knowledge that we will gain from this event. Happy International Women's Day from me, and God bless you. So let's move on to the next person. Thank you, ma'am Elizabeth, for your presentation. I think the next person would be Dr. Beatrice Onoja. You're welcome, ma'am.
Hello, good afternoon, everyone.
Good afternoon. You're welcome.
My name is Dr. Beatrice Onoja. I'm the ED of Various Things Ministry in Benue State. I'm also the state coordinator, AACSGBV, Benue State. Good to connect with you this evening. Thank you.
Thank you, Ma. Thank you, Ma. Any more introductions?
Okay, I think I can do that. My name is Joy Ighorodje. I'm the Executive Director of Okaha Women and Children Development Organization from Benue State. Thank you very much. And a member of the association.
Thank you very much for joining us, Ma.
Thank you.
Introductions, please. Who's there? Dr. Agboro, you have the floor, sir.
Yeah, my name is Dr. Agboro Andrew, the Chairman, Gender Justice, Delta State, Chairman, Task Force on Men and Girls with Disabilities, also a member of this association, Delta State. Thank you.
Thank you very much, sir. Thank you for coming on board. Any more introductions? Roll call. Thank you so much. Anybody?
Yes, I'm here. I'm sorry, I'm in another meeting, but I will put my camera soon. My name is Ighorodje, Executive Director, Working Fingers International Initiative. It's my pleasure and to welcome everyone. Thank you.
Welcome, National Chairperson, Ma. Thank you. We'll have you in a minute.
Thank you.
Any more introductions before we kick off? We want to be as fast as possible. Any more? I guess I'm not seeing any hands up. I think we'll move to goodwill messages now. We have some organizations with their goodwill messages. Dr. Agboro Andrew, please, sir, you have the floor. Can you give us your goodwill message? Thank you very much.
Thank you very much. My name is Dr. Agboro Andrew, and I'm honored to be part of this podium today. I'd like to start by commenting and complimenting the commitment of the organizers. Ladies and gentlemen, events such as this podium provides the opportunity for us to leapfrog into the critical, game-changing steps that are needed to address the issues of poor education, implementation of legislations, infrastructure, and services in the health system, including sexual, gender-based violence, and other health insecurities. Health, as we know, spans beyond the issue of disease. I wish to remind us here that health is a resource for everyday life, not the objective of living alone. It is a positive concept emphasizing social and personal resources as well as physical capacities. It does refer to the ability for us to maintain the status quo of ensuring everyone has a good condition of living. As we proceed with this meeting, I wish every one of us success, good contributions to see how we will strengthen our health services to attain better health for all. Thank you so much. I will proceed.
Thank you, sir. Very precise. Thank you so much. We appreciate you. Right about now, we'll ask for another goodwill messages, and that will be coming from Mrs. Joy Ijuo. Please, ma, you have the floor.
Good. Happy Sunday, everybody.
Sunday.
Can we hear me?
Yes, we hear you, ma.
Okay. Good evening, everybody. My name is Joy Ijuo. I'm speaking from Benue State. And for this special event, I'm speaking on behalf of the entire executive members and member organizations of the Association Against Child and Sexual and Based Violence from Benue State. We have collectively agreed to join this meeting today. I noticed that most of us are not here, but after my goodwill message, I will call them one by one to join us. Because of the importance of today and then the topic that will be taken by our fellow members from other states, and I know that the wealth of experience that they are going to be sharing with us will be a very great one. First and foremost, I want to wish everybody that is here and those that are not supposed beyond here and a happy International Health Day. Our health matters. We work a lot as development workers, and I know that each and every one of us, we benefit a lot from a meeting such as this. Most times we hear about webinars and Zoom meetings. Most people do not know the importance. You know, to get this kind of education can be very, very expensive. But you, the experts from the association, you have made it possible for us to sit in the comfort of our homes to benefit from webinars such as this. And I sincerely want to thank all of you. I want to thank especially the National Chairperson, Dr. Eric Jero, and also the National Coordinator for always sitting to think through topics, very important topics such as this, to put them together for member organizations to benefit from. I know that the awareness that we get today will benefit each and every one of us for our own health and for our community and for those people we are helping, especially the vulnerable ones. Let's also remember to take care of ourselves, especially our mental health. That matters a lot to me. I know sometimes we forget our mental health, but I wish to say, and I know that at the end of today, we all know the importance of it. So happy International World Health Day for all of us. Thank you very much.
Thank you so much, Benue chapter rep. Thank you so much. We appreciate you. Next, who do we have? Is Mrs. Justina from FCT, is she on board? Is Mrs. Justina there? If she's not yet online, is Ambassador Dr. Sophia Ndidi. Is she online? From Imo chapter? I think they're having network challenges too. Okay, if they come on board, I think we'll take theirs as we go on along. So let's move on. Right about now, I would like to call on our national chairperson, a very formidable, energetic, indefatigable woman, an Amazon, a trailblazer, to speak to us today on our topic, to just give us a keynote address shortly, and then we move on. Ambassador Dr. Aries Jero Ibi, ma'am, please, are you online?
Okay, thank you, my NC, and thank you everyone that is present in the house. I want to thank my NC, and with effect from next week, where some nomenclatures will change due to the changes we are currently embarked on in the association. So my health, my right is this year, 2024, is to emphasize the fact that the right of everyone, everywhere, is to have access to quality health services, education, information, as well as safe drinking water, hygiene, and all that. So it's our duty as community-based actors to ensure that we pass on these messages and other messages that we are going to get to on around us. I'll just go straight to one major activity that I told us on the platform that I'll be doing today. I want to just quickly unveil our new website. You know, when our NC was talking, she mentioned some things about the association that before now, many of us, those were not the things that we used to mention as our profile, you know, as our vision. So since January till now, we've been working behind the scenes to review some of those things. And we now have a new website, which I want to unveil now. My NC, the website remains www.AACSGBV.ng. .org.ng. After this meeting, you can please go there and you will get more information about our website. Then secondly, we also talked about our publication of our organization. Every maximum quarterly, but I'm sure in a few weeks, a few months, it may become monthly, but for now it's quarterly. And the magazine's name is Peace Places Magazine, and we already registered it with the National Library Commission. You know, all those things that we've been doing, we need to make these things more public and then more records. So those are the two things that I want to unveil today. NC, I don't know if you have, yes, this is the logo for the Peace Places magazine, and we'll be expecting contributions from all the states to this quarterly magazine. Already we have volume 1, volume 2, and volume 3 that will be available. After this meeting, we will send the link to us. Then, of course, the new site is already on, and some of our organizations are already there. So I want to appreciate every one of us that have been supporting the association. And then for our speakers for today, especially, some are not our old members. I want to really appreciate you for accepting to be our resource for today. It's a contribution also to the coalition. So I think I'll stop here to say thank you very much, and for us to have a good time as we commemorate this year's International Health Day. Your health, your rights. Thank you very much.
Thank you so much, our National
Yes.
Chairman.
Thank you, ma'am.
Thank you for all the goodies. So we have graphics for our board. Please do well to go on it. And also, feel free to send in your reports now so that we can also showcase it in the Peace Places magazine quarterly. Thank you so much. Next, we'll go to the citation of our speakers so we can start off this program in earnest. So let's meet our speakers. Mercy Ehimenim Nwugo-Achapokri is a seasoned professional with extensive experience in legal secretarial and personal assistant roles, excelling in customer service, retail, and operational efficiency. Currently managing her own business, ROS2 Lifted Global Enterprise in Asaba Delta State. She oversees all aspects of operations. Previously, she contributed as an associate at A.O. Odum, San & Co., optimizing research and development, and also served as an assistant lecturer at the University of Calabar. With a solid educational background, including degrees in law and peace studies and conflict resolution, Mercy demonstrates leadership, authenticity, and emotional intelligence in her diverse career endeavors. Next, is Dr. Ighorodje Edesiri, a consultant physician and dermatologist, holding the prestigious title of Fellow of the West African College of Physicians. Additionally, she was honored as a 2024 Fellow of the Open Medical Institute in Austria. Currently, she serves at the University of Uyo, Teaching Hospital in Uyo. Dr. Edesiri has been actively involved in various leadership roles within the Medical Women's Association of Nigeria in Akwa Ibom. She has held several executive positions and chaired numerous committees, demonstrating her commitment to advancing the goals of the organization. Beyond her medical profession, Dr. Edesiri is passionate about advocating for gender equality and promoting the welfare of girls and women. She proudly identifies as a FemActivist, dedicating her efforts to championing gender rights and empowering women in society. Our next speaker is Dr. Beatrice Onoja, a distinguished scholar holding a Ph.D. in literature. Alongside her role as an executive director in Glorious Teens Ministry, a faith-based NGO dedicated to youth empowerment, she serves as a pastor and part-time lecturer at J.S. Tucker University, Makurdi. Dr. Beatrice is also a passionate gender advocate, holding the position of state coordinator for AACSGBV Benue chapter. Her leadership extends across various capacities, reflecting her exceptional abilities. Additionally, she is a level 1 empowerment through self-defense instructor, certified by Empowerment Through Self-Defense Global in 2022. Next speaker is Konatwa Innocent Bagbi, a native of Bomu Town, Rivers State, a highly accomplished forensic accountant, business consultant, and development worker. With a degree and master's degree in accountancy from Rivers State University, he has over 15 years of diverse experience encompassing audit services, financial and operational management. Transitioning from accounting to development work, Mr. Bagbi has demonstrated a strong commitment to maternal health care and the protection of widows and vulnerable women. He has held pivotal roles such as finance manager for a local NGO and project associate for Pact Beaver Foundation, focusing on conflict resolution initiatives funded by the UK Commonwealth Office. Mr. Bagbi has honed his skills through various leadership and financial management courses facilitated by reputable organizations like UNICEF, USAID, and WaterAid. Currently, he serves as team lead at Jesimra Center for Development and senior partner at Jonathan Ergwan Company Chartered Accountants, showcasing acute managerial abilities. Furthermore, Mr. Bagbi plays crucial roles as the state focal person for the AACSGBV Rivers State Chapter and Secretary of the Association for Orphans and Vulnerable Children in Nigeria, Rivers State Chapter. He collaborates with DBI Foundation and Homes to provide shelter facilities for vulnerable children in Port Harcourt. And lastly, but not the least, is Daniel Ude, a visionary leader of Atriom Technologies Limited, dedicated to driving growth for startups and entrepreneurs through technological solutions and education. He advocates for global collaboration and investment, representing Nigeria at the World Business Angels Investment Forum. Daniel plays a key role in Nigeria's startup ecosystem, directing Startup Grid Asaba and CMX Connect Delta, while also facilitating for faith-driven entrepreneurs. With a passion for innovation and community building, Daniel is committed to propelling individuals and organizations towards success. Welcome, welcome, welcome. You can see that our distinguished speakers are top notch. Welcome, welcome. So let's start off with our discourse. We will take Dr. Edesiri to start off with her discussion. talking on the impact of GBV on health. Very, very pertinent topic. Please sit back and listen, and let's be active in participation. Thank you very much. Dr. Edesiri, please, you have the floor.
All right, thank you very much. Greetings, ladies and gentlemen. I hope I'm being heard. Thanks to the organizers for the invitation to contribute on the profound health implications of GBV, which is a menace that is so rampant and often remains shrouded in silence, specifically in a country like Nigeria, which usually bears a significant burden of this scourge. Next slide, please. So while we are commemorating World Health Day with the theme My Health, My Right, we should bear in mind that health is a fundamental human right of every individual, including GBV survivors, and anything that disrupts it will have clinical consequences. One of the speakers had really talked about defining health, but I'll go to the WHO definition, which is a state of complete physical, mental, and social well-being, and not just merely the absence of disease or infirmity.
Sorry, Dr. Edesiri. Sorry, Dr. Edesiri.
The second slide.
Sorry, Dr. Edesiri.
Yes. Yes.
We just want to let the other speakers be reminded. Princess Favor will be our timekeeper also, so that you will prompt you. You have 20 minutes, each of you. Thank you so much.
All right, thank you. So we asked ourselves, does GBV disrupt the physical, mental, and social well-being of the victim? And our answer is yes. And that's why it is now recognized or identified as a public health issue. Next slide. So let's go to the statistics to understand the burden of this public health issue. Globally, it is said that an estimated 1 in 3 women worldwide have experienced one form of GBV or the other. Means that in 1 in 3 women we encounter, they have already experienced it. In Nigeria, it's said that 30% of Nigerian women within their reproductive age have already experienced some form of sexual violence. Let's not also forget that the males are also affected. Now, GBV is defined, as we all know, any form of violence that is directed disproportionately to the person's gender. So while we discuss some general health issues of GBV, let's bear in mind that the health impacts usually affect mostly women. We should also not forget, next slide, that female genital mutilation is a form of GBV and is still practiced in communities and supported by even the educated persons in our society. Next slide. So silence is not golden. The impact of GBV is creating negative ripples in the health of victims. A victim of GBV should always seek medical attention. It doesn't just stop at getting justice, because we are looking at the holistic approach of managing these cases. So the ensuing health problems associated with GBV are not just limited to physical injuries, which could be lacerations, abrasion of different parts of the body, or disabilities. So let's look at the impact on health. We have those medical, it could be reproductive, it could be psychological, and even lead to death. So medical conditions these are already study-based. So it's already, there's an association between GBV and certain health conditions. They can easily be chronically disabling. We have what we call fibromyalgia, which is a complex rheumatic disease, mainly characterized by musculoskeletal pain, long-term musculoskeletal pain, usually not, cannot be explained, and then generalized tiredness or fatigue that does not decrease with rest. Some people have expressed that they wake up feeling severely beaten, sleepless night, extreme pain, exhaustion, and these can happen for certain people every day, every night. How this will affect not just the mental, but the physical. Can't go to work, can't have interpersonal relationships, will now maybe have to depend on medication. Others include irritable bowel syndrome, which is chronic abdominal pain associated with change in bowel frequency or appearance. So let's go to reproductive. We could have from infertility, complications of the pregnancy or abortions, STIs, and vaginal fistula. To break it down, let's give a scenario. A married lady is pregnant and has a partner abuses her physically. She loses the pregnancy, and sometimes this can lead to, damage to the uterus, which can cause infertility. Now, when we look at STI, we're not looking at just HIV. We're looking at other form of bacterial infection that can affect the pelvic region of a woman, and these things chronically can, of course, infertility, miscarriages, stillbirth, all these affecting her mental health. And there are also complications of abortions. Example, a young teenage girl experiences rape, and then in that whole circumstance, she gets pregnant. And because of the stigmatization, I mean, imagine a secondary school girl, how is she going to start managing her life as a mother at that tender age? And she doesn't tell anybody, and she goes to a quack, and she gets an abortion. That can affect her. It might not be damaged, total loss of pregnancy in future, but it can affect her womb and can manifest in miscarriages and abortions. Vaginal fistula is really very common in child marriage cases, and also even instrumentation. I mean, the perpetrators are becoming so bold now that I've seen a case where a gun is used to sexually abuse a woman. Instruments, rods have been used to sexually abuse a woman, and these things are going to have some physical damage on her reproductive organs. And we know for some that are interested in motherhood, you can see how much it's going to affect. I mean, a young girl that is living her normal life, gets raped, has a damage that maybe she did not see the doctor for, and then she goes on, gets married, and she's having difficulties getting pregnant. You can see the psychological things and even affectation of her interpersonal relationship. How it can affect that. So we also have psychological. It can range from as simple as anxiety to depression. Now, one thing you have to know that manifestation of psychological disorders, it has a wide range. Some people tend to feel that, oh, I didn't have control over this rape, I didn't have control over this domestic violence. So they manifest it negatively in abusing power, in having control. So we should think that not everybody that is so controlling per se is just wants to be like that. It's a psychological problem that has started, if you trace it way back to gender-based violence, especially in child abuse. And others could be in a bid to relieve the psychological problems, they engage in bad vices, so they can abuse recreational, even medical drugs, using recreational drugs, and some of these can have effects on the cardiovascular system or even cause renal damage. So there are a wide range of problems, and of course, death. It might not always be from the primary event, maybe physical assault, but also secondary, because with all these, with the way the society still views GBV survivors, they can become suicidal and take their own life. Now, note this is just a short list of these conditions. Depending on the form of the abuse, depending on where it occurred, like in places of war, conflicts, even IDP camps, there are a wide range. So we have our work cut out for us as physicians, because there are vast ways that this can occur, either short-term or long-term. Next slide, please. So to further understand how destructive GBV is to the health of survivors, I'll put a data by World Bank in its World Development Report, which estimates that 5 to 16% of healthy years of the life of women in their reproductive age are linked to GBV. Now, what that means is that the years involving our education, relationships, marriage, motherhood, career will all be disrupted So there is a gap. So you can see in the photo there, a woman, going to work, her career, the career at the stage of career, to the stage of education or motherhood, gets disrupted by any form of GBV. And she loses that, some years, healthy years that she would have used to contribute to society, to, because of all the psychological, all the health implications I've mentioned earlier. And she's going to try to, compensate and reach back. So it causes a great gap in the life of women that are affected, and even men that are affected by GBV. Remember that most of the men are usually experience GBV as children. So this causes a gap. Example, a teenage girl gets pregnant. What do? The general response is that the person should stop going to school. Now, for example, she doesn't get support from the society. It means she has to deliver, she has to take care of the child, she has to start working. All these years she would have used, if without GBV, to further her career, to get married, or have further her dreams or whatever they are. I mean, she's now a single mother, and we know how society views single mother. So it causes a huge gap. And we just celebrated International Women's Day, and we're advocating for society to invest in women. This is how we should invest in her, by not taking her precious years, which she would have, he or she would have contributed and impact their society. Next slide, please. So the ripple effects of GBV extends beyond the victims onto their children who witness these violence in their homes, and they are more likely to experience a range of health problems, including poor mental health and behavioral changes. Another example, so in the picture there, the man is assaulting the wife. The children are first of all witnessing it, which is not a very pleasant sight. And then in that event, the wife maybe dies. The man, justice is served, and the man is taken to prison. What happens to the children? The children are, of course, orphans, and they might be put in foster homes in an ideal situation. But what if they don't have accommodating uncles or relatives? It means that they are now exposed to perpetrators of GBV at such a tender age, and we can see the vast variety of things that they can get into. Foster homes, of course, are not devoid of perpetrators of GBV. Even with the relatives, they are still perpetrators of GBV. So we can see that there's going to be a vicious cycle of all these health problems, and we need to really nip it in the bud. So the role of health care providers here in addressing the health impacts of GBV requires a multifaceted approach. While we must strengthen our healthcare systems to ensure that survivors have access to comprehensive medical care, creating a supportive environment that encourages survivors to come forward, we should do that without making them have any fear of stigma. So our role here, first, we are first responders and a major point of referral to assist for their many needs. Well, first we can do by empathic, confidential medical evaluation and treatment. While we're assessing the physical injury, let's be sensitive. I mean, someone has just been attacked, has just been raped. That touching them, examining them can be very triggering. We need to provide prophylactic treatment for STIs and post-exposure prophylaxis for HIV, offer emergency contraception. And in all of this, let's not invalidate their reluctance or emotional outbursts. It might take a while for them to open up. Psychological support and referral. So to address the many psychological problems, PTSD, anxiety, with that, we also have a role to play. We also have to contact support groups for victims and survivors. So for hospitals around, private, public hospitals, it's important that the contacts of referral centers and support groups should be there, so that immediately a patient comes in that has been victimized in one way or the other, they can easily assess instead of just leaving their bed to go, because at that point the victim doesn't really know what to do. So we are there to help them, so we can assist them with contacting persons for legal aids and all of that. And I'm hoping, I do not know this, whether we have a hotline or a toll-free line that is as simple as 911 to get in contact with to get medical evaluation after the incident happened, because not everyone can walk to the hospital, and not everyone will have a hospital close by. So I hope that we have that. If not, we need to look into that, because that would really reduce the challenges of seeking help. Documentation and reporting. This one is actually very important. Documentation is important to analyze our current data and burden. People need to know that it is, where it happens, how it happens, who it affects. And it's used to draft SOPs and improve clinical approach in future. Like I said, perpetrators are becoming very bold. Physicians also need to be, and other health workers need to be educated on the various ways that this can happen and the consequences, so that because they can occur, they can present a very atypical manner. Example, clinically, genital warts is a sexually transmitted condition, skin condition. And sometimes I see it in children. Not all that have been sexually abused. So it doesn't just stop at medical evaluation. We talk about closure and justice. We're looking at hello?
Yes, we
Hello,
can
can
hear
you
you
hear
now.
me now?
Yeah, we can
Okay,
hear you.
okay, sorry. Okay, so I said that documentation and reporting is very important, especially for legal proceedings. We want these patients to have justice. We want them to have closure. Imagine this is not documented and the patient just comes. And we just let them go without having then training capacity. We need to equip healthcare providers and hospital managers with the knowledge and skills to effectively identify. Sorry, it's like someone's trying to call me. Sorry about that. Okay. All right, so training and capacity building. We also have to partner with healthcare providers, encourage a coordinated response. Can you hear me now?
Can hear you. Can hear you.
Hello?
We lost her. Well, I can hear you. So you're going on and in and out. We can hear you. Hello?
Hello. So MC, the time is almost over. So if you could just round up, that'd be fine.
Okay.
Hello, can you hear me?
Edesiri, we can hear you now. Please to round up.
Okay. So partnering with healthcare professionals or providers to encourage a coordinated response, including so that whenever a GBV patient survivor or victim presents. Example, in a police station or a safe house, the people there should be able to have the contact access to the individual. Gender-based violence is a public health priority, human rights, and an economics on every part of the individual.
Okay, that's time up.
When it comes to GBV, it's important challenges. Physicians are ethically obliged to inform them.
Dr. Edesiri. Oh wow, the network is terrible.
Let me just quickly round up because someone keeps calling me. I want to appreciate us all for not relenting and recommitting ourselves on different platforms to ending the cycle of gender-based violence. Thank you very much. I welcome any questions or comments.
Thank you, Dr. Edesiri. Mrs. Favor, are you there?
Yes, I am, ma'am.
You can go, you can continue.
Okay, thank you so much, Dr. Edesiri. That was a wonderful one, talking about the effects of gender-based violence on the health and helping us reinforcing the idea that we do need to stand up for our rights, with our rights in the aspect of being healthy and ensuring that there's that each and every body involved in the each and every body victim is given access to the right health equipment and right medical attention to ensure that they get the best treatment and they are able to come back from the vice of gender-based violence. So thank you very much. NC, I think we can move on to the next speaker. Thank you.
Yes, thank you. Barrister Mercy, you have the floor. You're next. Is she there? Barrister Mercy, she will be taking us on understanding health rights. Let's know the laws, the legal frameworks backing our health rights. How do we know our health rights? Barrister Mercy there? Can we see her online? I don't, or the network
No,
is
I don't think so too.
Okay. So if let's move to the next speaker. If Dr. Onoja is there, please kindly come on. Dr. Beatrice Onoja.
Yes, I'm here.
Okay, IT, please help us. Thank you.
Hello, good evening, everyone.
Good evening.
Good evening.
Happy World Health Day once again. All right, in the next 20 minutes, I'll be talking on health equity and social justice advocacy. The last speaker has already defined health. Of course, I know there are doctors in the house, medical doctors. I'm not a medical doctor. Mine is Ph.D. So she has this defined health, and of course, narrowing it down on the impact of GBV on health. So mine is health, equity, and social justice. Sorry, am I being heard? Can you hear me?
Loud and clear, ma'am.
All right.
I hear you.
All right. So let's, I just have 20 minutes, so I'll be as fast as possible, but I'll also like the class to be interactive. I would like to hear voices. I would like to hear the voice of others speaking to us too. So we're going to be doing this together. Let's have the next slide, which is the introduction. This is just giving us a background of something like a statistics. I'm talking on health, and you can see my introduction starts with women. That does not necessarily mean that we are focusing, that the topic is on women, but of course we know that when it talks about, when we come to health, women are most vulnerable. And here on this platform, we are advocates, we are gender advocates, and our focus is on the most vulnerable to see how we can be able to help ourselves to achieve what we should achieve in pushing the health of women and girls forward. So women in many parts of the world have limited access to reproductive healthcare services, including contraception and safe abortions, due to norms, practices, and cultural barriers. This is just to establish some quotes and statistics in regards to gender and health. The second quote, there's a gender-based violence, including intimate partner violence and sexual assault, disproportionately affects women and girls, leading to physical and psychological health consequences. The first speaker has established, I think, about 4 different aspects that GBV impacts on health, and that is medical, reproductive, psychological, and death. And you can agree with me as an advocate, gender advocate, that everything here, when it comes to the woman, is centers on the reproductive. Because when you talk about the psychological, when it is more impactful, when it impacts on the health of the women more, is when it comes to reproductive health. Medically, when it comes to reproductive health, and what can easily lead to the death of women and girls is also tied down to reproductive health. So reproductive health is key when it comes to the health of women and girls. Joy talked about mental health when she was giving her goodwill message. Mental health of a woman is also about 50% to 60% tied to her reproductive health, because most times we have had issues of women that gave birth, that is postnatal depression. We hear women that will give birth, after giving birth, some develop some form of mental health issues. Some die as a result of poor health access to poor health services. So women are more vulnerable when it comes to health services, accessing quality health services. So according to the World Health Organization, complications from pregnancy and childbirth are the leading cause of death among adolescent girls aged 15 to 19 in low and middle income countries like Nigeria. Now let's summarize it in what Nicole Bachelet said. She's the former executive director of UN Women. She said, gender-based violence is a public health epidemic that affects millions of women and girls worldwide. It's not just a woman's issue, it's a human rights issue. So to her, gender-based violence itself is a health issue, because when a woman is physically abused, it results to health issue. When a woman is psychologically abused, it results to health issue. When a woman is raped, it results to the same health issue. And if you check all of them, to be tied down around the reproductive health. Even the last speaker talked about gender-based violence as being one of the issues around health in one of the quotes that she gave. So the next slide now, let's talk about it. I would like 1 or 2 persons to look at this quote and just say 1 or 2 things that you understand by this. this quote. It says, women's health needs to be front and center. It often isn't, but it needs to be. That's Melinda Gates. So maybe in 2 minutes, can I have someone, some persons, 2 or 3 persons to just comment on this in regards to health equity? So that we are sure that we are all following. Hello? I hope I've not been talking to myself.
No, our participants, please, let's be active on the platform, please.
Please, I would like to
ask a question again.
Yes, look at the by Melinda Gates. It says women's health needs to be front and center. It often isn't, but it needs to be. That's Melinda Gates. So in regards to health equity, can someone just throw more light as in what you understood by that quote, relating it to health equity?
When women are healthy, the nation is healthy, children are good, our income or economic power is good.
I also have a contribution.
Okay.
The quote there, I think, to me, she's trying to say that women's health should be prioritized. It should be prioritized by the government. It should be prioritized by development workers, and it should be prioritized by all, because women are the center. You know, they say when one woman is healthy, she makes her household healthy, the community and the society will be healthy. So it starts with the woman and it ends with the woman. So women's health needs to be prioritized. Thank you.
Thank you very much, George. Thank you, Lucy. Because of our time, we'll just move ahead. Thank you very much for your contribution. So women's health needs to be front and center. That is, it needs to be prioritized, like Joy rightly said. But there's something she said there. She said it often isn't. And that is the health equity we are talking about. So there is inequity when it comes to women's health. Women's health are not being prioritized. It's supposed to be prioritized, but it is not. So there is a problem, there is a gap. So what's the next thing she said there? She said, but it needs to be. So someone has to make it be. And that is the advocacy we are talking about. And that is why we are here. And that is why we are civil society organizations. And that is why we are the ones that could go out there and make it to happen. So understanding health equity. Health equity refers to the principle that everyone should have the opportunity to attain their highest level of health, that everybody should be able to access quality health care. Everybody should have that platform to access all that needs to be assessed to be healthy mentally, psychologically, and otherwise. The second one said it recognizes the health disparities that exist due to social, economic, and environmental factors rather than inherent differences in individuals. What are they trying to say is that health equity should not be based on individual, should not be based on gender. You know, this gender is supposed to be healthier or supposed to access better health care than the other, or this person is supposed to access better health care than the other. Everybody has the right. In the introduction, we saw that quote that says it's a human right. It's the right of everyone to access quality health care, especially the women, if we come back to Melinda Gates' quote, because like the two contributors rightly said, when the woman is healthy, then the nation will be healthy. And like I earlier said, the health of a woman is tied around her reproductive system. Yes, that is mostly. is tied around her reproductive system. So if a woman is not healthy, she will not be able to give birth to healthy children. She will not be able, and if she's not mentally knowledgeable on the issues of health, she will not even know how to raise her children to be healthy. So it rises and falls on the shoulder of the woman to be healthy in order to pass a healthy lifestyle to her immediate family and the community at large. Understanding social justice advocacy. Social justice advocacy refers to the active and intentional efforts to promote fairness, equality, and equity within society by addressing systemic injustice and advocating for social change. I have mentioned that before. It is our duty. When Jo was speaking, she talked about, calling on the government, the communities, we civil society, international partners, we all have to come together, you understand, to intentionally put our efforts to promote fairness, equity, and equality within our society to address the issues of health, to make sure that everyone has that access to quality health care. Social justice advocacy aims to challenge discriminatory practices, policies, and structures that perpetuate inequality and marginalization based on factors such as race, ethnicity, gender, sexuality, socioeconomic status, disabilities, and others. There's a lot that hinders women and girls from accessing the right kind of health services. Sometimes could be myth, like when it comes to family planning, we have had situations where the man will not allow his wife to access family planning, and she's the one, the reproductive issues bother so much on her, and she doesn't have the right to access family planning for herself, except when the husband agrees to that. We have had situations, even in this country, we have had situations where a woman needs to go for a cesarean session, but because her husband did not sign, she did not go for that cesarean section, and what happened? She died in the pregnancy. So these are the barriers that has hindered women and girls. These are the things that have bothered so much on the health of women. Every individual has right to do what? To access quality health care. And that is why social justice advocacy is something that we need to do intentionally to change some policies. The hospital should change their policy of making it a must for a husband to sign before the woman goes into cesarean section. It's her body, it's her right. So why is it that it's the husband that will have to sign before she access such services? So these are the things we ought to do under social justice advocacy. What are the social determinants of health? Social determinants of health are the conditions in which people are born, grow, live, work, and age. What are they trying to say? Sometimes what happens over time becomes a norm. Like what I just said now, the man has to assent to a woman or endorse a woman going into cesarean section, endorse for a woman to access family planning. So over time, it has become that way. Even as the woman is growing in a particular setting, in a particular environment, it has become a norm. So she felt that it's just normal for her to, for her husband to be the one to determine whether she will access a particular kind of healthcare or not. So there is that tendency of she passing it down to her own children too. So her girl child, there's that possibility of her girl child to also, come in to believe that, and it goes on and on. These are the things that also determine how people view their health, how people view their access to quality health care. The next slide, because of our time, I will just be running. The next slide, please. Impacts of inequity on health. Hello? Health inequities contribute to disparities in health outcomes, leading to higher rates of illness, disability, and so equity. Even when it comes to health issues that borders on women and girls, it can result to death. Like the example I gave before, the man refused because against his faith. Remember what we talked about, social determinants of health, you know, the way people view life, maybe through religion, through their environment, you know. So there are some men that maybe their religion do not permit them, or they believe their religion tells them that no, a woman must and should give birth through vaginal birth. You know, should give birth through the vagina. There's nothing like, you know, God forbid, in my family, there's nothing like CS. You know, CS is from the devil. That is their belief system, the environment grow from. So what happened? What could be the impact? From the story I gave before, the impact now is that the woman dies. The impact now is that we might lose we might lose both the mother and the child. So there is impact of a great impact of inequity on health, especially when it comes to women and girls. Like for instance, even growing up, a young girl within the reproductive age, there's some certain kind of food that she's supposed to eat that will help her reproductive system. Like I earlier said, I'm not a medical doctor, but over time, with the little activities we are doing around the civil society, we have got to know that when it comes to reproductive health, the girl child's nutrition, the kind of food that she eats, even growing up as a young girl, is of most important, because that will also show forth or will come to, you know, it will have impact on her, especially when she now starts giving birth. Either it affects her ability to give birth, it affects even the baby itself. Children that are known to be giving birth with low weight is also based on nutrition. So sometimes women girls are not even allowed to have access to, you know, good quality nutrition. Maybe the man of the house is the one that eats all the best food. The young men are the one that are giving, you know, some kind of nutritious food or nutritional aspect the one that we know that has, for now, we use it to make some joke, is that when a chicken is killed, is the man of the house that eats the gizzard. And some medical people have come to let us know that the gizzard is the most nutritious. Unfortunately, it's the man that eats it. When it is the girl child or the woman that needs it the most, because she's going to give birth to life. She's going to produce another life. I'm a poultry farmer, and from my little experience and from, you know, what they have taught us and which I'm seeing coming to pass in what I do, in production of eggs, the pullets, when you are bringing them up, what they eat within that period of brooding, the time that you are preparing them for egg laying, the way you handle them, the kind of nutritious food you give to them determines the kind of quality eggs they will produce. So it's the same thing in human. So that's why I'm bringing this gender.
Yes, Mama, you have 2 minutes to round up. Oh, thank you.
All right. So there are a lot of impacts of inequity on, especially on women and girls. And these women and girls most vulnerable are people in the communities, people in the IDPs. Some they don't even know anything about taking care of their health. Our mental health, how do we take care of it? In fact, even we that are on this platform as educators, how much have you really invested in taking care of yourself? As a nursing mother, when I just got married, my first pregnancy that I went for CS, and they were saying my PCV was very low, that they will need to get a blood before I can go for the cesarean section. Thank God that no blood was transfused. But nobody educated me on, you know, these are the things I should be eating. You know, there was not much education. So that is why we are talking about advocacy. Can I go to the last slide? That's before the question, so that I can talk about social justice advocacy. What we should be doing as CSOs. The next slide. What we should be doing as CSOs is to make sure that we advocate to the government, to advocate even to international partners. You know, I used to tell my people here in Benue, I said, most times we find it difficult to invest, especially international donors. They find it difficult to invest money on awareness, sensitization. They feel that's something that anybody can just go and do. You don't need much finances. The truth of the matter is that if we must reach the grassroots, and these are the people that need this awareness the most, money is involved. So the government needs to invest. All stakeholders need to invest so that people will begin to get aware, so that even from the girl child within that reproductive age of 15, she has already known what she should do to prepare herself for the future. What she should do to even prevent, some mental illnesses that comes with the reproduction, especially that comes with giving birth. Nutrition is key. She needs to know what she should be taking before, during, and after pregnancy. Thank you. I will stop here for now.
Thank you so much, Dr. Dr. Beatrice Onoja. In fact, that was a wonderful one, because I'm happy that you hammered the social justice advocacy. And when we talk about advocacy, right, advocacy really is for the victims of these, advocacy is really rather for the stakeholders of these of this gender-based violence, talking about the actual victims, because I believe that if they know their rights, if they know that they shouldn't be facing these things, they'd be able to stand up adequately, right? They'd be able to curb these things when they arise, when they arise. So I want to encourage us, and thank you so much, Dr. Onoja, and I want to encourage us and join us that we should at every point in time reinforce this message of advocacy against gender-based violence. Ensure you are teaching. In fact, it doesn't have to be full-on gender-based violence, right? Because you see certain traits before it blows up. You see traits in people. A majority of our men that are where they are now, that are perpetrators, they were showing certain traits when they were younger. And if you're able to advocate to these mothers and tell them that I'm seeing such a trait in your child, is this how your husband behaves? Well, for you to be able to stop this thing in this child, you need to start teaching this child early on to respect women. And you teach them the effect of these things and how to curb it and the impact of a healthy society. Thank you all so much. Thank you, Dr. Beatrice. That was a wonderful one. I sincerely appreciate you. And I can't wait.
Thank you so much, Doc, my buddy.
Yes, thank you.
Happy Sunday and happy World Health Day to you. Thank you so much for that. You have shown your scholarly attributes. Yes, right about now.
Hello, Auntie. We stopped hearing you.
Okay. Hello, good evening, everyone.
Good evening, ma'am.
Yeah, my name is Mercy. I'm Nwugo-Achapokri. I'm very grateful to the coordinator and the assistant and everyone involved in bringing about this virtual meeting today. Thank you very much for having me. So my topic today is understanding health rights. I'll first start with a definition. When I'm talking about health rights, I could also be using right to health interchangeably. So I'll be starting with the definition of terms. The right to health is the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. The right to health extends to ensuring clean water, sanitation, food, nutrition, and through a comprehensive system of healthcare. I'll give you a brief history of the World Health Day. The World Health Day is observed annually on April 7th, and it was first observed in 1950 and has been celebrated on April 7th ever since. The World Health Organization established this day to mark its founding anniversary and to raise awareness about pressing health issues around the world. I'm going back to the purpose of today's meeting. I'm sorry I don't have my slides. My system crashed this morning, so I'm just doing what I can with the little I could jot down.
Sorry about that, ma'am.
Thank you. So the right to health is inclusive, extending not only to timely and appropriate health care, but also to the underlying determinants of health. This includes an adequate supply of safe food, nutrition, and housing, access to safe and potable water and adequate sanitation, healthy occupational and environmental conditions, and access to health-related education and information, including on sexual and reproductive health. The right to health contains both freedoms and entitlements. The freedoms include the right to control one's health, including the right to be free from non-consensual medical treatment and experimentation. How do I mean? Sometimes you could go to a clinic and the nurse will want to administer a drug to you. You have a right to ask the nurse or doctor what medication they want to administer to you. And sometimes you see some doctors bring in some residents, a consultant could come with some residents to use you as because they are trying to teach them. You also have a right to say, I do not want my body to be used for lecture for your students. Then the entitlements include the right to a health protection system, that is healthcare and the underlying social determinants of health that provides equality of opportunity for people to enjoy the highest attainable standards of health. The right to physical and mental health is a broad concept that can be broken down into more specific entitlements, such as the right to maternal, child and reproductive health, informed consent, bodily integrity, and freedom from torture, ill treatment, and harmful practices. Healthy, natural, and workplace environments, the prevention, treatment, and control of diseases, including access to essential medicines and access to safe and potable water. The right to health also means that everyone should be entitled to control their own health and body, including having access to sexual and reproductive information and services, free from violence and discrimination. International human rights frameworks. While disease outbreaks and other acute public health risks are often unpredictable and require a range of responses, the International Health Regulations 2005 provide an overarching legal framework that defines countries' rights and obligations in handling public health events and emergencies that have the potential to cross borders. The International Health Regulation, that is IHR, is an instrument of international law that is legally binding on 196 countries, including Nigeria, and including the 194 WHO member states. The IHR grew from the response to deadly epidemics that once overran Europe. They create rights and obligations for countries, including the requirement to report public health events. The regulations also outline the criteria to determine whether or not a particular event constitutes a public health emergency of international concern. At the same time, Yeah, it's really dark. At the same time, the IHR requires countries to designate a national IHR focal point for communications with WHO to establish and maintain core capacities for surveillance and response, including at designated points of entry. Additional provisions address the areas of international travel and transport, such as the health documents required for international traffic. Finally, the IHR introduces important safeguards to protect the rights of travelers and other persons concerning the treatment of personal data, informed consent, and non-discrimination. All this I'm saying is this IHR is like the body that governs everything as regards to an outbreak. Like when COVID-19 happened, these regulations was what was used by the WHO to restrict movements around the world. Because as long as you have signed to it, you are bound by it. The right to health is accorded recognition by several international treaties, of most of which Nigeria is a party. The most important of these treaties are the International Covenant on Economic, Social, and Cultural Rights, ICESCR, Convention on the Elimination of All Forms of Discrimination, CERD, the Convention on the Elimination of All Forms of Discrimination Against Women, CEDAW. I know that one is very popular. That is CEDAW. And the Convention on the Rights of the Child, CRC. Nigeria is also a party to two health-related civil and political rights treaties, namely the International Covenant on Civil and Political Rights and the Convention Against Torture and Other Cruel, Inhuman, or Degrading Treatment or Punishment. Regionally, the right to health is guaranteed under the African Charter on Human and People's Rights. Nationally, it is guaranteed under Chapter 2 of the Constitution of the Federal Republic of Nigeria, 1999, as amended. The National Health Insurance Scheme Act, 1999, etc. Legislation that criminalizes violence against women codifies the rights of women to live free of violence. There are conventions, there are treaties that take care of this. And I think I mentioned the 1979 Convention on the Elimination of All Forms of Discrimination Against Women, CEDAW. This was a major step forward in establishing key rights for women and has to date been ratified by 188 states. It obliges states to take all appropriate measures, including legislation, to modify or abolish existing laws, regulations, customs, and practices which constitute discrimination against women. The original CEDAW did not explicitly prohibit violence against women, but rather outlawed discrimination against women in all forms. Subsequent oh my God. Excuse me, please. I need to get light here. The house is getting really dark. Okay, you can see better now. Subsequent the right to health is accorded recognition by several international treaties, of which I've already mentioned: CEDAW, CEDS, ICCRS, ICESCR, and all these legislations They protect against violence to women and about the health of everyone. The laws that talk about protection of rights health is the Chapter 2 of the Constitution of the Federal Republic of Nigeria and the National Health Insurance Act. So under this act and this statute, you have a right to medical care. Is not free for now, unless you are under the National Health Insurance Scheme. That's why if you are a salaried under a salaried employment, you are advised to enroll into this scheme so that a stipend will be deducted from your salary monthly, which could cover you at any point in time when you are in the hospital. If you are maybe if you are charged, let me say 1 million naira, I think it's about 10% you have to pay at that time, 10%, which is about 100K. So it's important that it's wanting to know the rights, it's wanting to know about these laws, but it's more important to take advantage of what is available. So if you know you have a steady source of income and you should enroll under the National Health Insurance Scheme. And I think they have offices in almost every state in Nigeria. Then for the laws that protect women, the subsequent recommendations issued by the CEDAW committee, which oversees state compliance with the convention, has explicitly defined discrimination to include violence against women. Specifically, the committee's general recommendation number 19 broadly defines discrimination to incorporate gender-based violence, including physical, mental, or sexual harm or suffering, threats of such acts, coercion, and other deprivations of liberty. This recommendation also clarifies that states may also be responsible for private acts if they fail to act with due diligence to prevent violations of rights or to investigate and punish acts of violence, and for providing compensation. This implies that states are responsible for inaction in preventing acts of gender-based violence. I know you'll be asking that we're talking about health rights, why are you talking about gender-based violence? When I was called up to take up this Convention on the Prevention, Punishment, and Eradication of Violence Against Women, 1994, guiding principles for a strategy on violence against women. It affirms that women have a right to be free from violence in both the public and private spheres, and hold the state accountable for preventing standards. This is the first convention directed solely at eliminating violence against women. The protocol to the African Charter on Human and People's Rights of women's rights to life, integrity, and security of the person and dignity. Article 1 defines violence against women as including all acts perpetrated against women. Maputo publishes legal obligations. The Committee of Ministers of the Council of Europe adopted a regional convention on preventing and combating violence against women and domestic violence in 2011, also known as the Istanbul I'm calling a lot of treaties and conventions. Most of our health rights and human rights laws are born from international conventions and treaties. come out from nowhere, but all these conventions and treaties that have been held over the years. The ninth basic international foundation for combating violence against women. It lays out the rights and principles of equality, security, liberty, integrity, and dignity of all people, including the binding force of treaties, but can contribute to the development of international legal norms and jurisprudence. Okay.
Yeah, hello, Ma'am Mercy. You have 2 minutes remaining, so if you could please just round up. Thank you. Hello.
Okay, United Nations World Conference on Human Rights in Vienna in 1993. Women's rights were explicitly accepted as human rights, paving the way for the integration of women's rights into human rights norms and practices. Before this, women's human rights were mostly absent from the international human rights agenda because the human rights framework maintained a dichotomy between the public and private spheres. Because the human rights agenda had conventionally concerned itself primarily with acts taking place in the public sphere, intimate partner violence was regarded as being beyond its scope. That same year, another important landmark was the UN Declaration on the Elimination of Violence Against Women, DEVAW, DEVAW, adopted by the General Assembly, which defines violence as any act of gender-based violence that results in or is likely to result in physical, sexual, or psychological harm or suffering to women, including threats of such acts, coercion, or arbitrary deprivation of liberty, whether occurring in public or in private life. It calls all states to exercise due diligence to prevent, investigate, and in accordance with national legislation, punish acts of violence against women, whether those acts perpetrated by the state or by private persons. Article 4 of the declaration requires member states to condemn violence against women and not invoke custom, tradition, or religion to avoid their obligations to eliminate such violence. Like I said now, custom, we have some places where the female genital mutilation is normal in some customs, and in some traditions, a woman that her husband has died, widowhood practices are made to drink the bath of their dead husband. This is not accepted internationally, and this law rules, this declaration rules it out as not acceptable. The DEVAW is also important because for the first time, marital rape was defined as a violence against women. While declarations are not, hello?
Thank you, ma'am. Yes, time is up. Thank you very much. Yes, thank you.
It's going so fast.
Ma? yes. Sorry about that. I think probably because of the short intervals that you took. That was why it seemed so fast. Yes. So, well, there was something you said that stuck with me from the beginning, and I think it is very important that we all know that, and that is speaking to being able to defend yourself, and when you go to the hospital, talking about being administered drugs and you wanting to know what you're being given, right? Yeah. So I'm happy with the fact that you said that when you go to the hospital, you can choose to ask questions. I think it is important that we all know that we should ask questions, because in Nigeria, I mean, we're all familiar with how the health system works, and by God's grace, we're working towards a better health system, but sometimes nobody is above mistake. So it is good that you are aware and you're able to understand these things so that you'd be able to know how to hello, yeah, can you hear me?
I didn't get your question. I was caught off by a call.
Okay, no, it wasn't a question. What I was saying is that I'm glad you said that we can ask the question of what we are being administered when we go to the hospital, that we have that right to know, right? Because like we talk about allergic reactions, we talk about sensitivity. There are a lot of people that are sensitive to certain drugs and certain medications, and if you don't know your rights to stand up and say no, I can't be given such a drug, you would, at the end of the day, you might lose out, you might lose your life, or it might cause some kind of bad effect on you. So it is very necessary that we ask these questions, we know what we're given, and we stand up for our rights in the health, in accordance to health. So thank you so much. That was a powerful session. Thank you very much, ma'am. Mercy.
Welcome. Thank you so much for having me.
Thank you. The network is very unstable over at NC's side, so I will be the one taking over with the speakers at about now. So on to Mr. Daniel.
All right. Just a moment, let me share my screen. I'm delighted to be here today. It's always an awesome delight to be part of the meeting here. So today I'll be speaking on the role of technology in healthcare. It's quite an interesting topic. No doubt, technology has revolutionized every aspect of our daily lives. For some of us, the smartphone has become like a second identity. You know, breakthroughs in medical technology have propelled healthcare forward, enabling more accurate diagnosis, personalized treatment plans, and ultimately better outcome for patients. Telemedicine and remote monitoring, for instance, have emerged as game changers, offering patients access to healthcare services from anywhere, reducing the barrier to care and enhancing convenience, particularly for those who are in remote and underserved areas. Nowhere is the impact of technology more profound than in the field of healthcare. Technology is reshaping the way healthcare is delivered, managed, and experienced. The transition from traditional paper-based health records to electronic health records has ushered in a new era of efficiency and accessibility in healthcare. This has also facilitated the seamless communication between healthcare providers, ensuring continuity of care and minimizing errors. From the digital transformation of healthcare records to harnessing the power of artificial intelligence and machine learning, technology continues to evolve. And as technology continues to evolve, it will play an increasingly vital role in shaping the future of healthcare. For instance, artificial intelligence algorithms can now analyze vast amounts of data to identify patterns, predict disease progression, and assist in clinical decision makings. Machine learning algorithms, for instance, can also analyze medical imaging, enabling the healthcare professionals to focus on more complex cases and improving the diagnostic accuracy. Technology continues to play a transformative role in the healthcare, from enhancing prevention efforts, empowering survivors, training healthcare providers, to improving access to healthcare services. Technology continues to transform the healthcare industry. Enhancing prevention efforts is significant for various reasons, including reduction of gender-based violence burden, promotion of well-being, improving health outcomes. And technology enables targeted messaging campaigns tailored to specific population, delivering health promotion messages, reminders for preventive screenings, and information about vaccination campaigns through digital channels such as social media, SMS, and emails. Remote monitoring technologies enable healthcare providers to remotely track patients' health status and adherence to the preventive measures, allowing for early detection of potential health risks and timely intervention. Technology enables the development of digital health intervention that promotes preventive health, such as wellness apps, online health education programs, and interactive tools for behavioral change. Wearable devices, including fitness trackers and smartwatches, empowers individuals to monitor their health in real time, providing valuable insights into their well-being. The psychological trauma of the experience of GBV somehow disempowers the survivors. So it is imperative that the survivors are empowered, and technology provides survivors with access to comprehensive information about their condition, treatment options, and support resources that are available, which may include online platforms, reputable websites, and other educational materials that empower the survivors to make informed decisions about their healthcare journey. Social media groups, online platforms, and virtual support communities connect survivors with peers who share similar experiences. This platform fosters a sense of belonging, validation, and solidarity, empowering survivors to share their stories and seek advice and offer support to others. Telemedicine platform enables survivors to access counseling, therapy, and support, overcoming barriers such as transportation challenges and geographical limitation. Virtual counseling sessions provide survivors with a safe and confidential space to discuss their concerns and receive emotional support. We know that sometimes these survivors go ahead to become advocates to create awareness campaign. Technology also amplifies their voice by providing platforms for advocacy and raising awareness about their experiences. Social media campaigns, online petitions, and digital storytelling initiatives empower survivors to advocate for policy change, raising awareness about the issues that affect their community and challenge stigma and the discrimination that they may face as a result of their experience. Just as we are on this platform, technology also helps with training and capacity building for healthcare providers. We see advanced technologies such as virtual reality and augmented reality transforming medical training, patient education, and therapeutic intervention, offering immersive and engaging experiences. According to a research published by the National Institute for Biotechnology Information, Nigeria's healthcare system faces challenges as only 43.3% of our population are able to access healthcare. Telemedicine platform enables gender-based violence survivors to access healthcare services remotely, overcoming the barriers such as transportation challenges, stigma, and geographical isolation. Survivors can receive confidential consultation, counseling, and follow-up care from healthcare providers via video conferencing or phone calls, ensuring timely intervention and support. And we know how important timely intervention and support is to survivors of GBV and to their health. Telehealth platforms offer a range of services, including virtual consultation, remote monitoring, and online prescription reviews, expanding access to care and reducing the cost of healthcare. Mobile health apps provide survivors with convenient access to a range of healthcare resources and support services. This app offers features such as educational materials on gender-based violence, crisis hotline, appointment scheduling, medication reminders, and self-care tools. Survivors can access information, connect with support networks, and manage the healthcare needs discreetly and efficiently, empowering them to take control of their health and their well-being. Like I said before, wearable devices and remote monitoring devices enable healthcare providers to monitor the health of the health status of the GBV survivors remotely, detecting signs of distress or relapse and providing timely intervention. These technologies can track vital signs, activity levels, sleep patterns, and medication adherence, facilitating personalized care and support tailored to the needs of each survivor. Technology also allows for the collection and analysis of data on gender-based violence prevalence, risk factors, and healthcare utilization patterns, informing the development of targeted intervention and policy initiatives. By harnessing data and artificial intelligence, healthcare providers and policymakers can identify the various gaps in service delivery and prioritizing resources and improve the responsiveness of the healthcare system to the needs of gender-based violence survivors. Now, there are challenges to the adoption of technology within the healthcare system. For instance, some may say, oh, what happens to my data? What happens to the data I offer up for this within this technology system? And that is one of the major valid concerns. Another concern is digital literacy, as some persons are not even aware of or able to understand how to navigate some of these digital platforms and tools. But to mitigate some of these concerns, for the privacy concern, implementing an encryption and strict data security measures mitigates that concern. Encryption simply means the coding of the information supplied in such a way that a third party is not able to understand what information it is. It is just the encoding of it so that they're not able to decipher what the information is. And then for digital literacy, to develop user-friendly interfaces and products, and then provide trainings for healthcare providers and survivors can mitigate the digital literacy concern. Now, what are some of the real-world examples of use of technology-based intervention in healthcare setting? Now, it doesn't have to be something very big, or it doesn't have to be a mobile app or a website, such as exemplified by the campaign that AB InBev put forth in South Africa. They implemented a dedicated WhatsApp line for discreet reporting of GBV cases and seeking assistance, showcasing the effectiveness of technology in providing support and intervention. Very close to home here, Life Bank, which is a Nigerian company, provides a digital platform to connect blood banks with hospitals in need of blood transfusion. Their platform enables real-time intervention, real-time inventory management, efficient blood matching, and timely delivery of blood supplies to hospital. Another company is Pedigree, who is in Ghana. What they do simply is to provide a mobile and web-based platform to combat counterfeit medication. The platform allows consumers to verify the authenticity of any pharmaceutical product by simply sending a text to a specific number, and the text simply contains a unique code that is found on the packaging of the product. These are some ways that technology have been used in healthcare. Now, close to home, we at Atriom Technology, how are we using technology to improve healthcare access for GBV survivors? We identified a problem and profiled a solution to the problem. The current problem lies in the significant gap between organizations offering social support services and the individuals who need these services. I'm sure that many of us on this platform listening to me right now can relate to this. People want the services that your organization is offering, but they don't they either do not know that your organization exists, or they are in remote places where they cannot even visit your organization. So we provided a gender inclusive platform to link clients with relevant organizations, thus ensuring fingertip access to report incidents of social injustice and request social support services. This is one way we are utilizing technology to improve access to healthcare. So in conclusion, technology plays a vital role in healthcare for combating gender-based violence, and continued innovation and collaboration is essential. Collaboration in campaign management and campaign organization, collaboration in investments is also key. By leveraging the of technology and fostering collaboration, healthcare system can enhance support for survivors of GBV, ultimately contributing to better outcome for the patients. So thank you so much for the opportunity to speak with you today. Thank you so much.
Wow. Wow, wow, wow. Thank you so much, Mr. Daniel. I was talking about the wonderful work Mr. Daniel did just now, breaking down this technology and how it can be used in provision of healthcare and in respect to gender-based violence. And I'm so glad we're talking about these, because technology is the future. Technology is the future. And if we don't know how to maximize the advantage of technology, we will be totally left behind. We could see this case studies of how technology has been able to advance healthcare and how it's positively impacting the victims and the stakeholders as well. So thank you so much. And I know that the association is very intrigued by technology. I remember that our last conference, which was in Edo State, the theme was accelerating inclusion, accelerating technology and inclusion, the role of state actors and non-state actors. So this goes to show our commitment towards ensuring that we are taking advantage of technology and imputing it to advance our efforts to curb gender-based violence. Thank you so much, Mr. Daniel. So we're moving on to Mr. Innocent. Hello, sir. Are you here with us? NC, is there anything you'd like to say?
Oh, nothing much. I'm very grateful to all the speakers. They have gone through their topics brilliantly. Thank you.
All right, thank you so much, NC. Thank you, Mr. Daniel. Thank you, Mrs. Mercy. Thank you, Dr. Ighorodje. Thank you, Dr. Onoja. Wonderful, wonderful sessions we've had with you. We are definitely not leaving here the same. So right about now, I want to know, do we have questions for our speakers? Yes, the slides were very colorful. And
good evening, everyone. Yes.
Oh, yes, Mama Mingo.
Yes.
Thank you.
Yes, I want to lend my voice to that of Dr. Onyi to thank all our speakers.
Okay, please can the slides be shared? Yes, the
general slides will be shared on the general platform, please.
Okay, thank you so much.
So those who send in their emails, so can share to you later on.